Okay, now let's talk about mastering select all that apply questions. So as you guys know, SATA questions are the worst. Literally one letter away from Satan. Now these are so hard. It's not just memorizing a big list. So remember, lists are bad. We don't like to tell you guys to memorize lists. So let's talk about a few simple rules. So rule number one is just ask yourself about safety principles. Simply ask, what kills this patient first? Or what harms first? Select all that apply questions just want to see if you know the principle of safety, and that's it. Now, rule number two is find the key words. So circle the key problem and really what the question's asking. Then before looking at the options, think about 2 to 3 things that are gonna kill or harm the client first. Now, when you get a select all that apply question, or really any question for that matter, you just need to find the key problem inside the question. So for example, any disease or any medication or any procedure, and then you identify that key problem and see what the question is asking. After that, then just think about 2 to 3 things that are gonna kill or harm the client first. Now, once you think about 2 to 3 things that will kill or harm, then go back and look at the options and choose the best answer. It's honestly as simple as that. Now, yes, it's gonna take some practice, but we show you how to do this in our 3-step question breakdown system in our question bank. For example, let's just say I have 4 clients with cardiac condition. I'm focused on the principle of safety. So basically, what kills or harms first? So if I have a client recovering from an MI heart attack, I'm not focused on lists and lists of info. I'm really focused on the principle of safety here. So just think, in an MI, heart muscles die. So what are 2 to 3 things that show that the heart is dying? And is the client showing any worsening signs and symptoms for heart function, or really any new or sudden changes here that indicate a worsening critical condition? So the keywords on the NCLEX that show worsening condition, be sure to write this down. New, sudden, abrupt, rapid, and even worsening. If you see those keywords on the NCLEX, this is never a good thing. You either need to assess, intervene, or educate the client immediately here. For example, on the NCLEX, let's just say the word abruptly, like abruptly stopping steroids. Now this can be deadly for anyone. We need to slowly step away from steroids, like slowly landing a plane. How about rapid weight gain? The key term is rapid, and weight gain means water gain. This can be a deadly sign for a client with heart failure. What about the key term worsening? Like worsening crackles in the lung. This can be deadly. We're talking fluid-filled lungs that are getting worse. The client can literally drown in their own fluid. What about the word sudden? Like a sudden change in respiratory sound. Now this can be deadly, as airway and breathing are number 1 here. Now rule number 3 is, if in doubt, go without. Always ask if it's necessary in terms of safety. Remember, the NCLEX is just simply that safety exam. So stop talking yourself into the wrong options by stretching for options outside the area of possibility. Always ask, is this necessary for this client's problem? And what the question is asking for right now, because it technically most times is not. Now, according to the last NCLEX update, they're planning to give partial credit for select all that apply questions. Now, this may change in the future, but this can be a good thing. It's actually good news. You see, in the past, select all that apply questions were either 100% right or 100% wrong. So the biggest takeaway here is don't over-select. If you don't know, just don't select it. This is where students get into that gray area with select all that apply questions and get it wrong. So you know what you're doing, just don't overthink it here. Stop talking yourself into options that don't align. I mean, how many times have you gone shopping for like one thing at Target, or really shopping in general, only to find out that you're gonna leave the store with 15 or 20 things that you didn't intend to get? This is a whole shopping cart full of stuff. It's because you got distracted and start picking things that you really didn't need or did not intentionally go in for. In the same way, just focus on the key problem first. Focus on what the question's asking you. Then think 2 to 3 things about that key topic that align with safety. And then look at the options as a guiding light with those 2 to 3 things. So stop talking yourself into everything and anything. Now, rule number 4 is crucial. Always reread what the question's asking every time you choose an answer option here. So let's do an example question on the NCLEX. For example here, which adverse effects should the nurse monitor for in a client taking aspirin every 6 hours to treat cluster headaches. Select all that apply. Okay, so what's the key problem here? Well, it's taking aspirin for headaches, right? What's the question really asking? Well, the question's asking for adverse effects. Adverse effects of what? Well, duh, it's aspirin. So before looking at the options, write down 2 to 3 things you know about aspirin adverse effects, always related to safety. Simply ask what kills or harms this client first. Well, what is aspirin? Aspirin is an antiplatelet, right? So with aspirin, this lowers the platelet. Huge bleed risk. We're talking about bruising, GI bleeds, decreased platelets, and even a big risk for toxicity here in terms of ringing of the ears, that tinnitus. Okay, now let's look at the options here. Option 1, the presence of dark melena in the stool. This is correct. Remember, the big safety risk is for bleeding. So really any dark stool can indicate bleeding in the GI. Well, taking iron can also indicate dark stool as well. But always reread what the question's asking. It's asking for adverse effects of aspirin. So we have to think bleeding and toxicity here. Now, option number 2, decreased heart rate. Now you have to ask yourself, is this a bleed risk? Think about it here. Does aspirin work on the heart? Well, what if I stretch and maybe, no, just stop. It could thin the blood, maybe too much, and the heart rate could drop. No. Stop overstretching for options here. See what you're doing here? You're making assumptions on things that maybe or might be. So stop stretching for options. What was the 2 to 3 things you thought about aspirin at the beginning? If they don't align, then stop the overthinking here. So always remember, when in doubt, read what the question's asking. It's asking about adverse effects of aspirin, like bleeding and toxicity. So no decreased heart rate. If the client really was bleeding, it would be an increased heart rate. Now, option 3, increased bruising noted on the extremities. So think bleed risk. So in this case, this would be correct. Bruising can indicate bleeding from those antiplatelets, that decreased clotting, right? So again, read what is the question asking for adverse effects of aspirin, bleeding and toxicity. So bruising would be bleeding. Now, option 4, increased blood pressure. Is bleeding or toxicity a big risk with increased blood pressure? Well, you have to think, no. So it'd be incorrect. Is blood pressure affected by aspirin? Nope. Okay, so skip it. Now you're probably saying, Mike, but maybe, possibly, if the client is bleeding. No, stop. We would not have an increased blood pressure here. We could have a decreased blood pressure, but just stop stretching for options. Always reread what the question's asking. Asking for bleeding or toxicity related to those adverse effects of aspirin here. Okay, now option number 5. What about a platelet level of 100,000? Is that a bleed risk? Yes, this is correct. Huge safety issue here because aspirin lowers the platelets here. Anything less than 150,000 is bad. So that's why we say less than 150 can be very risky. The clients can bleed out and die here. So you see how this works here? Trust me, it's gonna take a little bit of practice, but select all that apply questions should not scare you. Just simply use the principles we're showing you, and you're gonna pass the NCLEX with flying colors. So a little recap here for the rules. Number 1, always focus on safety. Ask what kills or harms the client first, because as you know, the NCLEX is just a safety exam. Now, rule number 2 is circle the key problem and what the question is asking for. Then, before looking at the options, think about 2 to 3 things you know that are related to that key problem, and really what the question's asking. Now, rule number 3, if in doubt, just go without. Ask if it's absolutely necessary. And honestly, if you don't know, then just don't pick it. Simply skip that option. Now, rule number 4, which comes in clutch if you're between a few options. Always reread what the question's asking. Do it multiple times, again and again, for every option until you feel confident.